Hamstring flexibility becomes increasingly important after age 50 for maintaining mobility, preventing falls, and supporting daily function. Today we're focusing on safe progressive hamstring stretching through forward-folding movements, examining both physical benefits and proper technique. Forward folds can improve hamstring flexibility when practiced correctly, but require appropriate caution and realistic expectations. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new stretching routines, especially if you have back problems, disc issues, osteoporosis, or other health conditions. Understanding hamstring flexibility and aging hamstrings are three muscles on the back of your thigh running from hip to knee. They're essential for walking, standing from seated, climbing stairs, and maintaining proper posture. After 50, hamstring flexibility often decreases due to reduced activity levels, prolonged sitting, age-related changes in muscle and connective tissue, and cumulative postural habits. Tight hamstrings contribute to lower back discomfort, altered walking patterns, difficulty with forward-bending activities, and increased fall risk through reduced mobility. However, hamstring flexibility can improve at any age with appropriate consistent stretching. Realistic benefits of hamstring stretching. Benefit 1. Improved functional flexibility. Regular hamstring stretching can improve flexibility supporting daily activities. Improved hamstring flexibility may help with easier forward bending for tasks like tying shoes or picking up objects, reduced lower back strain during daily movements, better posture through balanced muscle length, and enhanced mobility for activities requiring hip flexion. Research shows that consistent stretching programs can improve hamstring flexibility in older adults, though improvements are gradual and individual. Flexibility gains support functional independence by making daily movements easier and more comfortable. However, extreme flexibility isn't necessary or appropriate for most older adults. The goal is comfortable functional range supporting your daily activities. Benefit 2. Reduced muscle tension and discomfort. Tight hamstrings contribute to muscle tension and discomfort. Regular stretching may help reduce chronic muscle tension in hamstrings and lower back, decrease discomfort from prolonged sitting or standing, improved comfort during daily activities, and enhanced overall sense of physical ease. While stretching doesn't cure underlying conditions, it can help manage symptoms of muscle tightness for many individuals. Combined with other healthy practices, hamstring stretching contributes to reduced physical tension and improved comfort during daily life. Benefit 3. Enhanced relaxation and stress reduction. Gentle stretching can promote relaxation beyond just physical effects. Forward folding with focused breathing may support activation of parasympathetic nervous system promoting relaxation, reduced physical tension often associated with stress, improved body awareness and mindfulness, and enhanced overall sense of calm. Many individuals report feeling more relaxed after gentle stretching routines. While stretching isn't treatment for anxiety or stress disorders, it can be a valuable component of overall stress management supporting both physical and mental well-being. Benefit 4. Improved posture and balance. Hamstring flexibility affects posture and balance. Improved flexibility may contribute to better pelvic alignment, reducing excessive lower back arch, improved standing posture, enhanced balance through better body mechanics, and reduced fall risk through improved mobility and body awareness. Balance and fall prevention involve multiple factors including strength, proprioception, and vestibular function. Hamstring flexibility is one component supporting overall balance and mobility, particularly important as we age when fall risk increases. Benefit 5. Maintained mobility and independence. Perhaps most importantly, hamstring flexibility supports continued mobility. Regular stretching helps maintain ability to perform daily activities independently, preserved range of motion for functional movements, reduced mobility limitations, and enhanced confidence in physical capabilities. Maintaining flexibility is a key component of healthy aging, supporting continued participation in activities you enjoy and preservation of functional independence. How to perform standing forward fold safely. Here's proper technique for standing forward fold with essential safety modifications. Starting position: stand with feet hip width apart, knees slightly bent throughout, never locked straight. Distribute weight evenly through both feet. Stand near wall or sturdy support within easy reach if balance is concerned. Engage core gently to support spine. Performing the fold, take deep breath in, lengthening spine. On exhale, begin folding forward from hips, not by rounding spine excessively. Keep knees bent throughout entire movement. Slide hands down front of thighs as you fold, using them for support. Only fold as far as comfortable while maintaining steady breathing. Stop when you feel gentle stretch in hamstrings or back. You may only fold slightly forward, which is perfectly acceptable. Hold comfortable position for 20 to 30 seconds initially. Breathe naturally throughout, never holding breath. To rise, press hands into thighs and slowly roll up, engaging core. Progression guidelines: start with very gentle partial folds, even just slight forward hinge. Practice once or twice daily. Hold for 20 to 30 seconds initially. Over weeks, gradually increase hold time to 60 to 90 seconds as comfortable. Never force deeper stretch. Progress should be gradual over weeks and months. Essential safety modifications: always keep knees bent. Locked knees increase lower back stress. Use wall or sturdy furniture for balance support if needed. Place hands on chair seat or blocks if you cannot reach thighs comfortably. For very limited flexibility, perform seated version sitting on chair edge and folding forward over thighs. If standing is problematic, perform all hamstring stretching seated or lying down. Critical form reminders: fold from hips, not by excessively rounding spine. Think of hinging at hip joints. Keep breathing steady and natural throughout. Forced breath holding indicates you're pushing too hard. Move slowly and mindfully. Quick movements increase injury risk. Stop immediately if you feel sharp pain, particularly in lower back or hamstrings. Mild stretch sensation is appropriate, pain is not. Who should avoid or significantly modify: do not perform standing forward folds without medical clearance if you have herniated or bulging discs, severe osteoporosis with high fracture risk, acute sciatica or radiating leg pain, severe spinal stenosis, recent back surgery, uncontrolled high blood pressure, inversions can temporarily raise blood pressure, or severe balance problems making standing exercises unsafe. Consult healthcare provider or physical therapist if uncertain whether forward folds are appropriate for your situation. Alternative hamstring stretches: if standing forward folds are inappropriate, try these alternatives. Seated hamstring stretch: sit on chair edge, extend one leg with heel on floor, fold forward from hips over extended leg. Supine hamstring stretch: lie on back, lift one leg, hold behind thigh, gently straighten knee until feeling stretch. Keep other leg bent with foot flat. Towel-assisted hamstring stretch: lying on back, loop towel around foot of lifted leg, use towel to gently assist stretch while keeping knee relatively straight. These alternatives provide hamstring stretching with better spinal support and control. Realistic expectations for flexibility improvement: hamstring flexibility improvements occur gradually and vary significantly between individuals. Weeks 1-4, learning proper technique and positioning. Becoming familiar with stretch sensation. Initial minor improvements in flexibility may occur. Establishing consistent practice routine. Weeks 4-12, more noticeable improvements in hamstring flexibility. Stretches feeling more comfortable and natural. Ability to fold slightly deeper while maintaining good form. Improved comfort during daily activities requiring hip flexion. Months 3-6, continued gradual flexibility improvements. Enhanced functional mobility for daily tasks. Established sustainable stretching routine. Better body awareness during forward bending. The goal isn't extreme flexibility but comfortable functional range supporting daily activities. Flexibility improvements are highly individual and depend on starting flexibility, consistency of practice, age, genetics, and other factors. Some individuals see significant improvements while others see modest changes. Both are valuable outcomes. Integrating hamstring stretching into daily routine. Hamstring stretching works best as part of regular routine. Practice once or twice daily, ideally when muscles are warm, such as after light activity or warm shower. Hold stretches for 20 to 90 seconds depending on comfort. Never bounce or force stretches. Breathe naturally throughout. Combine hamstring stretching with other flexibility work for hips, back, and lower body. Include strength exercises supporting muscles around joints. Stay active with regular walking or other activities as tolerated. Consistency over weeks and months produces best results. Daily brief stretching is better than occasional intense stretching sessions. Complementary practices for lower body flexibility. Hamstring stretching works best combined with hip flexor stretches for balanced flexibility, calf stretches supporting ankle and foot mobility, gentle spinal mobility exercises, lower body strengthening for joint support, and regular walking maintaining overall mobility. Comprehensive approach addressing multiple aspects of lower body flexibility and strength provides best overall results for maintaining mobility and function. The role of breathing during stretching. Proper breathing enhances stretching effectiveness and safety. Breathe naturally and steadily throughout stretches, never holding breath. Deep diaphragmatic breathing promotes relaxation supporting greater stretch. Exhaling during stretch can help muscles relax slightly more. Forced breathing or breath holding indicates you're pushing too hard. Natural comfortable breathing throughout stretch is essential for safety and effectiveness. Understanding stretch sensation versus pain. Learning to distinguish appropriate stretch from pain is crucial. Appropriate stretch feels like gentle pulling or mild tension in muscles, should feel tolerable and sustainable, typically rates 3 to 5 on 10-point discomfort scale, and never causes sharp or shooting sensations. Pain that requires medical attention includes sharp stabbing sensations, radiating pain down legs, pain that worsens with continued stretching, and pain that persists after stopping stretch. Always stop stretching if you experience pain beyond mild tension. Stretching should never be painful. No pain, no gain does not apply to flexibility training for older adults. When TO seek professional guidance, consult physical therapist or healthcare provider if you have uncertainty about appropriate stretches for your condition, persistent pain during or after stretching, significant asymmetry in flexibility between sides, history of hamstring injuries, or desire for personalized stretching program. Professional guidance ensures you're stretching safely and effectively for your individual situation. Conclusion. Standing forward folds and other hamstring stretches, when performed with proper technique and appropriate modifications, can help maintain and improve hamstring flexibility after 50. Benefits include improved functional flexibility for daily activities, reduced muscle tension and discomfort, enhanced relaxation and stress reduction, improved posture and balance, and maintained mobility and independence. Start with very gentle partial folds using all suggested modifications. Keep knees bent throughout to protect lower back. Progress gradually over weeks and months based on your response. Practice consistently once or twice daily for best results. Never force stretches or push through pain. Combined with regular walking, strength exercises, and other healthy practices, hamstring stretching contributes meaningfully to maintaining mobility, function, and quality of life after 50. Thank you for watching. For specific concerns about appropriate hamstring stretching for your situation, consult with a physical therapist or healthcare provider for personalized guidance. Subscribe for evidence-based information on flexibility, mobility, and functional fitness for older adults, practical guidance that prioritizes safety while helping you maintain comfortable movement and independence.